Hey everybody, Luke Gordon, physical therapist here, and in today's video I want to talk to you about what I think is the most common cause of knee pain. And believe it or not, it's not arthritis. So I'm going to tell you about all about this type of knee pain, and I'm going to tell you all of the contributing factors that really contribute to this knee pain so you understand what causes it, and from there we can start talking about how to treat it then. So just to dive right in, the most common cause of knee pain that we help clients with here in the PT clinic is patello-femoral joint pain, which is basically pain just beneath your kneecap. So if you ever have pain like towards the front of your knee or just below your kneecap, kind of underneath it, more than likely you're dealing with patello-femoral joint pain. And what that is basically your patella, which is your kneecap. It's kind of a small bone, and if you sit with your leg out in front of you and just relax it straight in front of you, you should be able to grab your kneecap and just kind of wiggle it around from side to side. So that's your patella. So it sits in a very shallow joint in your femur, and that's the femoral part of your patello-femoral joint, and it tracks up and down. So as you're bending your knee, it kind of tracks down the groove, and as you straighten your knee, it tracks up. And so for a lot of people then, what happens is the alignment of that kneecap, that little bone that you can move side to side, in its groove, it gets out of alignment, and that starts to create friction on one side of the joint, and that over time, and hundreds and thousands of steps, leads to pain. And so again, if you have pain right around your kneecap, kind of in the front of your knee, just below or underneath your kneecap, more than likely that's what you're dealing with, is patello-femoral joint pain. So again, just understanding that what causes that is the tracking gets out of alignment with your kneecap. Now we can talk about, okay, well, what causes that, the tracking to get out of alignment, and then what can you do about it? So let me just kind of rattle off the multiple factors that can really contribute to this type of pain to, again, help us understand how to treat it. So the biggest thing you'll see with people that have patello-femoral joint pain is that they'll have weakness in their quad muscles. So your quads, again, are your big muscles on the front of your thigh. It's the biggest muscle group you have, specifically that inside portion of your quad, which in PT land we call your VMO. The fibers of that portion of your quad are oriented in a way that it's going to keep your kneecap pulled to the inside of the groove, which I should go back a little bit. When your kneecap tends to be out of alignment, it's usually tracking towards the outside of your groove. And again, it's creating friction along those two joint surfaces instead of having a nice, even tracking surface for the joint there. So that VMO, that portion of your quad, when it's strong, it pulls your patella back towards the midline, back towards the inside of the joint, and that's where it feels good and that's where it wants to be. So that's one thing, one underlying factor with this type of pain is that your quads can be weak, especially that inside quad. We're not going to talk about how to treat that yet. I just want to let you know how this all works. So the quad is definitely one of them. Research has also shown that just as important as your quad being weak is if you have weakness in your hip muscles. So right around your hip, like the outside of your hip, you have your hip abductor muscle, gluteus medius we call it. On the back, you've got some rotator muscles. And basically what happens is if you have weakness in your hip, that affects the rotational alignment of your femur. So that big bone in your leg and your thigh. So when you get weakness in the muscles, the bone will tend to kind of go towards your midline, kind of like knock-kneed, and it'll rotate in a little bit. Now, if you can imagine your femur, your thigh rotating in towards the midline, essentially what it's doing is it's taking your kneecap and it's tracking it to the outside, which again is not where it likes to be, and that causes pain. So that's your second really big factor, mechanically speaking, is hip weakness. So that's the second thing that we can focus on when we get down to treatment. The third thing that you want to look at is that a lot of times people also have flat feet where your foot, you got a nice arch there, has kind of collapsed inwards and down towards the ground. And if you can imagine your foot collapsing in towards midline, then your knee is going to follow suit, right? When you're standing and walking and running, all those things. So when your foot collapses down and towards the inside, your knee also follows suit, and that changes the alignment of your knee again towards the midline. And essentially what you've done is your kneecap is now tracking towards the outside, again, where it doesn't like to be. So those are three big things to look at: your quads, quad strength, hip strength and alignment, and then your foot. A couple other things that I want to mention just to help you fully understand what causes this type of pain. The other thing that you want to check out in that region is your IT band. So IT band is that kind of real firm, thick fiber structure right along the outside of your thigh. I've got some videos on that as well. But if that's tight and painful, it actually attaches to the outside of your kneecap. So when that gets really tight and irritated, it can start to pull your kneecap out of alignment there too. So check your IT bands. And then just a couple more things I want to mention is that oftentimes, I said the most common cause of knee pain is not arthritis, but oftentimes people who have arthritis are also dealing with this type of pain, this patello-femoral joint pain. Because if you can imagine, if you have arthritis and it's kind of, deeper pain in your joint, and now it's a little more difficult for you to walk, difficult for you to squat down, to go up and down stairs, do some other things that you like to do like golf, pickleball, walking, hiking, then inevitably what you're going to find is that your quad muscles and your hip and core muscles are going to get weak over time. So just because you have arthritis doesn't mean that arthritis is the only cause of your pain. So you might look into that, you say, well, Luke, this doesn't apply to me. I've got arthritis. The arthritis is the cause of my pain. That may not be the full story. So look into this as well. I've treated plenty of people in their 60s, 70s, and 80s who have arthritis, but they can still respond really positively to treatment for the patello-femoral joint pain. I think that's all I wanted to say on the topic. So just consider all those factors, again, your quads in terms of the muscle strength, your hip strength, your feet, your IT band, and arthritis. And that's the overall global picture for patello-femoral joint pain. I'm about to make another video that will discuss how to treat that, so I'll link that here as soon as I can. For now, I'm going to link, I've got some videos on top 5 exercises to perform with this type of, again, patello-femoral joint pain. And then if you do have more advanced arthritis and you're looking for more information on how to work with arthritis and maybe you're getting closer to a total knee, I have a ton of videos on that too. I'll pop up one here about the top 4 exercises to help you prepare for total knee replacement surgery too. So that's a lot of information for one video. I hope you enjoyed it. Again, I'll make another video to follow this one up about how to treat this type of pain. I'll give you the whole entire picture of what you need to do in terms of not just your exercises and stretches, but other types of techniques to reduce pain as well. So stay tuned for that. Thank you for watching. Please like and subscribe before you go, and I always love to hear your comments as well. That's it for now. Thank you.